from www.oldguytalks.com, where we're helping older guys create kick-ass lives for themselves and those that they love. Part of that is us talking about things that, well, some people find a little uncomfortable to talk about. And one of those subjects is erectile dysfunction. And tonight we have Dr. Shawn Blick, an expert in this area. But before we get to that, I have to follow the instructions of my lawyer, Sue, the IP lawyer babe. She wants me to read this medical disclaimer. It says basically this. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. The old guy's a capitalist and not a socialist weasel. He may be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You will have different results because we are all very, very different. So now we got that piece of legalese behind us, and my lawyer is happy. So Dr. Blick, he's founded the Valley Urological Associates. He's been practicing for over 19 years, specializing in a lot of areas and having to do with ED. He also treats low testosterone, BPH, enlarged prostate cancer. He also has taught multiple courses on advanced techniques for penile prosthesis, which is going to be the major topic that we're going to be talking about here. And many of you, maybe some of you have ambitions of being a porn star, and this may be your path to being famous. And so that's one possibility for you. He's the founder of ED Specialists of Arizona, and also has created several websites with beyondthebluepill.com. That's your website
correct.
Also?
That's one website.
So
yeah,
that's one website. You got. We'll talk about the websites that you have, he's widely recognized. He's the top 10 penile implanters in the United States, and that's a lot. That's right. That's a lot of surgeries that you do. And he's recently joined the GainsWave team in Shockwave. Well, it's not really Shockwave, but it sounds so cool when they say Shockwave therapy. So welcome to the program.
Thank you. Thank you, Lars.
And so my question to you is, what is the epidemiology? It's hard for me to say. What percentage of men suffer from ED?
Well, let's put it this way. The Massachusetts Aging Study, which is a large epidemiological trial looking to assess the population of men that might have various types of erectile dysfunction, estimates that we have somewhere between 30 to 40 million American males with some form of erectile dysfunction. About 52% of those have moderate to severe ED. So it's millions of American males over the age of 50 who have moderate to severe erectile dysfunction. And it's some people say that 1 in 5 men over the age of 20 will develop it in their lifetime. So it's an extremely prevalent problem that we're all dealing with as we age. It is a disease of aging.
Yeah. What are the grading categories? Like mild, moderate, extreme? How do you fit those in? How do you make that diagnosis?
Yeah, that's a good question. There is a sexual health inventory module for which we ask basic questions. And based on your score on that, we can categorize men from mild to moderate to severe based on your score. And so it's just simple questions about whether you can have an erection satisfactory for intercourse, maintain an erection for penetration, et cetera. And so you go through a series of these questions. It's a very simple, validated questionnaire, and it helps stratify men into different categories.
Okay. One of the things that I've heard, I don't know, are you seeing younger patients than you have in the past, or what's the kind of age range of patients that you see?
Well, it's the range, let's put it this way. This is definitely a disease of aging in general. So I will say that as men get older, we see a higher percentage of men with erectile dysfunction, but it doesn't necessarily mean that younger men can't have it. For example, we have patients with diabetes that often present much earlier, have much more refractory, difficult disease to treat because they have a more multifactorial, means that they have multiple reasons why they have ED. It's more complex, it's harder to treat, and they present much, much earlier. So we have diabetes that are earlier. We have spinal cord patients that may present earlier. Sometimes men present with low testosterone earlier, which we're seeing more and more of today. And so it is possible to see erectile dysfunction in the younger population. I'm not sure if it's fair to say that it is rapidly on the rise. This is still definitively a disease of aging, and that's because as we age, we find that we have more blood flow problems, and this tends to be a blood flow problem in the vast majority of men.
Okay. Is the erectile dysfunction a sign of other health issues?
It can be. I'll tell you how I see it. Men who present with ED may be, we may be uncovering, or let me say it this way. Men with ED may have cardiovascular connection. So I like to counsel my men that if they present to me with ED, that they may be presenting with silent heart disease as much as 4 to 5 years in advance. And that the reason is just simply put that this is a vascular disorder. And if the blood vessels in the penis are narrowing, it's very possible that the blood vessels in the heart are going to narrow. So we all know that men who present with ED or have ED have a much higher rate of heart attacks and strokes years down the road. So ED and the cardiovascular connection is really important. And also a lot of the risk factors for heart disease, such as diabetes, hypertension, obesity, low testosterone, and other things, they're risk factors for erectile dysfunction. So they go kind of hand in hand. So men that present with ED, I try to make the cardiovascular connection, and we certainly look for some of these other risk factors so that we can manage these things in a functional way, because some men might just be able to lose weight, do diet and exercise, and possibly control some variables and maybe do better without necessarily requiring invasive therapies or medications, for example.
Okay. How do you see it affecting the life of a man and their partner? What happens there?
It's a great question. A lot of times, erectile dysfunction, we focus so much on the sex, the raw sex, because that's what men care about a lot. But people often underestimate the power of the psychology of ED. And so I guess what I mean by that is that men that have ED sometimes feel less whole as a man. They feel less self-esteem. They feel less self-confidence. And some of them go on to full-on pure depression. So potentially has a profound effect on their quality of life and on their intimacy and their relationships. We may get to it as we go along, but penile implants, when men get them, for example, restores their sense of manhood, independent of the sex. They feel more whole as a man. They feel more self-confident. Their self-esteem improves. And because of all that, they tend to have a better intimacy, a better quality of life. They relate better to their partner, even if they have sex once in a year, for that matter, just because they know that they can.
Yeah. We're not going to get into this, but if it's just once a year, you're certainly not getting a great ROI on the.
That's not ROI would be poor in that case. But I think you understand the point. The psychology is really important. And it really improves the psychology of the male. It improves their overall sense of well-being, and that is totally independent of their sexuality. And I think that's an important point people miss. Yeah.
Okay. How much of the ED? Now you said there's an effect on the psychology, but how much ED is actually psychological in terms of people getting it in their brain that they're not performing as well and all that? How much is it psychological?
So I usually quote people that somewhere between 80–90% of patients have organic medical ED, and that psychology is only about 10 to 20%. But please understand that all men that get ED probably take on some form of psychological ED as well. Think about it. You get when you have a bad situation where you don't perform to your best ability, what happens? You create some anxiety, which then feeds back and potentially creates worse performance, and it cycles and cycles around positive feedback. Yeah, until you can't perform at all. So 80–90% organic, 10–20% psychology, rough estimate. How do
you deal with the psychology of it?
So good question. I first of all, I counsel them a little bit on my own, but we have a sexual therapist in our office. We have ED Specialists of Arizona. It's a center of excellence for men's health and penile implant surgery, but it's a comprehensive service. So we're not just looking to give people pills and push them out of our office. We're doing very thorough histories and physicals. We're evaluating them comprehensively. And as part of our whole center of excellence, we have a sexual therapist who happens to be my wife, by the way, who does awesome work. So when I have men that I deem to have psychological ED after all my evaluations, I can refer them to her and have had excellent outcomes. I can only brag about the kind of work that she's done.
Oh, wonderful, wonderful.
Yeah, she's awesome.
I just posted a link to your office and website
Oh,
and
thank you.
also phone number to get to you. So let's talk about the therapist thing. I think people kind of poo-poo it, and I think that a lot of times that may be the thing that's really will help improve the quality of their life.
Well, let me say this. I have many men who come to me swearing that they don't have psychological ED. Physicians, high, profile people, intelligent, who have sworn in front of me that for sure they don't have psychological ED. And after our testing, both laboratory, history, and physical, something called a duplex Doppler, which evaluates blood flow in the penis, after all that's said and done, we have determined that they look like more psychological profile. I've referred them to my wife for evaluation. And to be honest with you, we've never been wrong. There's so many variables that are going into this that you'd be profound. You would be, profoundly surprised. People have everything from sexual abuse to psychological issues to sexual preference issues to religious overtones that affecting their ability to perform in certain ways. You name it. There's just so many variables. And when I'm talking to them, I'm talking to the tip of the iceberg. Truthfully, I'm just meeting them and I'm just talking to the top of it. And my wife gets down to the bottom of it, really figures out a lot of the details. And it's just amazing to find out what's going on in people's lives and their relationships and their backgrounds, how they were raised, their family dynamics. It's just so comprehensive. And ED is just like a little barometer of what's going on in the rest of their life many times. And so many of the men I've referred that way are off their medications. They don't require anything. Their quality of lives have been improved. Their relationships are more secure. Relationships that weren't secure have been broken and they've moved on. They're in just such better place in their life. And most of them don't require anything for their ED whatsoever. They have just moved on and are psychologically well. It's amazing.
I was just listening to you talk, and I can just by your enthusiasm, I can see that you really love what you do. I mean, there's a certain amount of passion when you start talking about this. That really it was actually very infectious.
Oh, thank you. I appreciate that. That's just coming out of my blood. I can't stop it.
I could tell. I felt it. I mean, it was there. So let's talk about one of the areas that you're specialized in and very well known and an expert. Penile implants. How long have they been in use?
Well, they started out in the early 70s. There are different kinds. There's inflatable and malleable, but they started in the 70s, and they've all evolved over the time to becoming more durable, more natural, better quality mechanics, and better patient satisfaction rate overall over time. Infection rates have dropped because the products are antibiotic impregnated today, making them much less likely to have an infection. In fact, probably the lowest rate of infection of any implant you could put in the body today. So they started early. They've been around for, let's say, since the early 70s. Probably well over 500,000 plus have been performed to date. Maybe closer to 1 million.
Okay, so tell us just a little bit more about the actual implant and how it works and how's it work and what's it made out of, just out of curiosity?
Well, most of them are some made out of a silicone polymer. So it's not toxic though. You can't leach silicone into the body, but it's made out of a silicone plastic, if you would, that's soft and malleable, obviously. And it's designed to contain salt water. It holds salt water to create its hydraulic pressure.
Okay.
So, and that's, yeah, go ahead.
And how's that the hydraulic? Okay, so basically, is there a pumping mechanism, or how's that work?
So let me say this, because I just alluded to it earlier. There's malleable implants, which are always rigid, and they don't contain anything in them but like a little metal inside surrounded by a silicone base. And they're malleable. They're like kind of almost like always hard. And then you've got the inflatable. Okay, but I'll tell you, don't underestimate the value of those, because there are patients that need them and they're highly effective. But that being said, the inflatable kind is what's most common in the United States, especially. And so we'll be talking tonight mostly about inflatable penile implants for the purposes. Okay.
So how do you decide when to go with the permanent hard-on versus the malleable one?
So let's say a guy doesn't. All right. So it's a great question. So let's say you have poor manual dexterity. Let's say you just your hand. Let's say you have Parkinson's and you can't pump it, or you have a spinal cord injury, you can't pump the device. Or you're just someone who wants less mechanics and you just rather be ready on demand without having to do anything. Or sometimes financial gets in the way, and malleables are less expensive, and maybe that's a variable. These things come into play, and someone may choose a malleable device because it's simpler to put in. It's easier to utilize. You don't require a pumping mechanism. They are more durable. They're less likely to require change. And so there are takers for the malleable implant. But with all due respect, the inflatable is the standard of care in the United States and has the highest patient satisfaction rate because it creates a little bit better length and girth. It is soft when it wants to be soft and hard when it wants to be hard. And it's a little bit more discreet and hideable. And so it tends to be more popular. So I decide based on patient preference and what makes sense for them. But most of the time, we're talking about inflatable penile implants for most men who have the dexterity to utilize a pump. Now, that being said, you asked a question about how does it work? The inflatable implants come in different varieties, but for the sake of this conversation, we'll talk about a 3-piece inflatable implant. What we're talking about with 3 pieces is we're talking about a pump, we're talking about a reservoir that holds salt water, and we're talking about cylinders that go through the shaft of the penis that create the hydraulic pressure. So when you pump the pump, salt water will move from the reservoir into the cylinders, creating a rock hard erection. And that erection will last for as long as you want, whenever you want. Even if you have an orgasm, you maintain that erection. So right off the bat, that's awesome, correct? It's awesome.
Oh, wonderful! It's a guy's dream, and
it's a guy's dream.
Yeah,
right. It's just it's almost unbelievable. It's almost like that part's like, really? That's almost too good to be true. But if I tell you more about it, I tell you that this does not affect your sensation. It doesn't affect your orgasm. It doesn't affect your ejaculation. It's completely invisible, very discreet. Nobody knows you have it. It doesn't go off in the airport. Okay. It's very natural. So it's soft when you want to be soft, hard when you want to be hard. And I should say that it feels good for you and it feels good for your partner. So the male who has the implant likes it as well as the partner likes it. It feels natural and it's extremely durable. And when I say durable, I mean 90% of patients have a functioning implant in 10 years. So if you're a 60-year-old man, you're likely to have a functioning implant at 70 years old 90% of the time, if that makes sense.
Okay. Yeah. So I'm gonna give a shout out to Jay here, my buddy.
No problem.
Hey, Jay, thanks for joining us. So you mentioned replacing them. How often do you have to? 10 years is a long time for anything, but at some point, I assume you've replaced some. So is it difficult to replace them, and how does that process work?
So replacement is easy. First of all, we do these through a small 3-centimeter opening where your pubic hair is. It's possible to do it through the scrotum, but we do it where the pubic hair is located. And through that opening, we can make a small opening and take an old one out and put a new one in very, very easily. So if it breaks somewhere in its life, which it probably will if it's used, we simply can make a small opening, take an old one out and put a new one in. It's not hard to do. Patients do really well. And we basically can change the tires and get you back out on the road really quickly.
It does sound like there's like a warranty deal. So now so I'm really got to ask the obvious question. How do you pump it up? So how's that occur?
Basically you reach down to your scrotum with your own hands and you find the pump and you pump it. That's it. It's just it's like playing.
Either that or you have your partner pump it up to the desired consistency that they want.
It's an option.
So okay, all right. So we got that. Let's talk about the procedure itself, the actual procedure that's done in the office. What's it involve? How long does it take? And all that stuff.
So very important. The penile implant is done in the operating room. That's important. It is a surgical procedure. Like I said, we do it in 30 to 40 minutes. through a small 3-centimeter opening where the pubic hair is located. When I'm done, we leave you completely inflated on purpose, so you're up. Therefore, you do need a catheter to pee. That's a drain that allows urine to come out. We put a little extra drain to pick up a little extra blood, and we wrap you up tight with a compressive dressing. And in the morning, we see you back in under 24 hours. We take the catheter out. We take the drain out. We deflate you. And I will say this, and I mean this sincerely, it does not look like we did the surgery at all. There's no black and blue. There's no swelling. There's nothing. It just looks awesome at that point. Patients have different levels of pain, but the majority of men have modest pain discomfort overnight. And there are many men who will tell me they didn't even take the pain meds at all. Over the next few days, there'll be some swelling, there'll be some black and blue, but it's modest. And by the end of a week, 95% of men are off pain pills if they took them. Most of the recovery is over at 1 week. And by 3 weeks, we're teaching patients how to inflate and deflate the device. And by 4 weeks, you're able to use the implant for normal sexual intercourse. And I will tell you, it's 1 month of a modest recovery for an absolute life-changing transformational procedure that will improve your entire quality of life. It's truly long-term erectile restoration. It fixes the problem.
Mm-hmm. So basically, it's a month without any sex.
Exactly.
Which for the person that has only sex once a year, it's no big deal.
So, yeah, it's a small. I think it's a modest amount of time to give up, sacrifice.
Yeah, sacrifice. Maybe do it as part of some sort of penance for something or whatever. So risk and complications.
Good questions. The risks I think are on the lower side. The major thing that we worry about with any implant is an infection. But as I've alluded to, is that the implant is antibiotic impregnated. Infection rates today are less than 1% in busy implanters like myself. So it's relatively uncommon to have an infection. That being said, nobody's impervious to one, but it's relatively rare. I suppose there's always the risk for pain, but that is usually limited to the process of the procedure and is usually modest and well managed. Otherwise, the risks are really low. I think that's the majority of it. Those are the big things. Overall, patient satisfaction rates are in the high 90s because it's spontaneous, it's reliable, there's no ongoing side effects and costs when it's finished. Insurance usually covers this, Medicare covers this. And so it's just a very, very highly satisfactory procedure with very high gain and very low complication and risk. One really important point, Aris, is that it's irreversible. You really got to make sure patients understand that if they are proceeding, it's akin to getting a knee or a hip replacement. You can't take it out and hope to walk or run. You're going to rely on this for the rest of your life, and that's important.
So you just said something that surprised me. Medicare pays for this?
Medicare pays for it, and if you've got a secondary, you're completely covered 100%.
Wow.
Yep.
I was under the impression that this was an elective procedure. This was a pay cash out of your own pocket. Wow.
No, I think Medicare, let's just say CMS, views this as a reconstructive surgery for a medical problem. Men have a medical issue, and we're solving their medical issue. Erectile dysfunction is not just a whimsical, oh, I need to have sex. As we talked about, profound psychological impact on men and their quality of life. And it is definitively a medical problem, and we're fixing it. And I'll tell you, it's really important that we make sure we continue to be able to fix it.
Okay, so I don't know if you can see the comments section. I think you used to be able to. I think Facebook now doesn't allow it.
I see the comments. I do that. I see that. Hold on.
Do you see? So Jay's got a smart ass question.
Okay.
Do you pick this? Do you get to pick the size?
Great question. Yeah. If I could give guys maximal size, I'd be probably on the beach right now. But I'll tell you this: there are different strokes for different folks. So I make a measurement and customize the size to each individual patient. So we make a measurement on the penis with maximum stretch, because it won't take more than the penis on maximum stretch. And I take a downward measurement on the inside of the penis and an outward measurement that stretches out as far as it can go, and I add it together. And I take that measurement and fit the implant to put the maximum amount that I can get into the penis safely. If I put too much, like any carpenter, the molding will not fit. It just will buckle and it won't work. So the art of it is maximizing the maximum size that any one individual will take. I will tell you, the implants that I choose, that I work with, come in a variety of sizes. So they come in 12 centimeters, 15 centimeters, 18 centimeters. 21 centimeters and 24 centimeters. And then there's a variety of rear tip extenders to match the size exactly to what I need.
Just for the record, I know that if I need this procedure, I'll need a 24 centimeter one.
That's fair enough.
Bullshit.
I was kid around. I said, I need 29 centimeters, but it's all proximal.
So, okay. So, let's, any contraindications?
Certainly people who are immunocompromised might want to consider using caution. I have implanted HIV positive patients before, so it's not a definitive contraindication, but it's used with caution. Same thing with diabetics that have high hemoglobin A1Cs that are not poor. That's the way they control their diabetes. If it's poorly controlled, they have much higher rates of infection, and you should use caution. Anybody that has an infection would be contraindicated. An open sore or an active urinary tract infection, or something like where you feel that the urine could be colonized, a bad skin rash or an upper respiratory infection, all would be contraindications. But otherwise, most patients we can do. It's very uncommon for us not to be able to proceed. So I do patients with spinal cord injuries. I do patients that are immunocompromised that just use a lot of caution, a lot of antibiotics, and extra care.
Okay. Wow. Shawn, anything I haven't asked about this penile implants that we need to cover?
I should say that when it's not covered by insurance, we do it for cash.
Okay.
We charge $16,500 for it in cash, and we do it in a surgery center. As far as pricing goes, that's probably the cheaper of what's out there in the market. So if you search for cash pay penile implants, you'd find people charging as much as $20,000-$25,000. So our pricing is really well constructed for men that need cash pay. So we offer that. And but otherwise, I think you did an awesome job of guiding me through. Thank you.
Okay.
Ars.
Thank you. Well, and then the people always ask, I assume you have, or I don't know, maybe I shouldn't assume that. You have some plans where you can do outside financing and things like that. Is that correct or not?
They used to have it through the company. Otherwise, I do not. So it's it really isn't any particular financing that I've come across at this point. So people have to figure it out on their own. Sure.
Okay. All right. So let's talk about something new that you're doing in the office, the GainsWave therapy for ED. Tell us a little bit about that.
So GainsWave is nothing short of a marketing term for a product that is really called low intensity shockwave lithotripsy. So it's using low intensity shocks to the penis at a certain number of times in specific anatomical locations over a specified period of time to improve the blood flow of the penis, to optimize and improve sexual performance. The benefits are that first of all, I need to very much say this, that it's still by the Sexual Medicine Society of North America considered to be experimental. That means that the product technically isn't FDA approved for the purposes of for improving sexual function or erectile dysfunction. However, that being said, there have been studies going on internationally and also in the United States more recently over the last 15 years. And there's good data to support that this is effective, that it's improving men's sexual health inventory score, like we talked about, making them improve their scores and get better sexual performance. And I use it as a tool in my box. I think it's important that people looking for natural, non-medical, non-medication, non-surgical solutions, and they're reading the literature that's out there that's international. GainsWave does an awesome job of assembling 40 clinical trials that represent the data on this. And so the preponderance of data suggests clinical improvement. And although it still gets deemed experimental by the Sexual Medicine Society of North America, we all feel it's very safe and reasonably effective and an option that we can offer to our patients who are looking for alternatives.
Yeah. Okay. Yeah, because I know when I was at your office the other day, or actually just several weeks ago, that you were just looking into it and wanted to really look at the science of it before you decide to sign on with it.
Exactly. And I had attended the American Urologic Society meeting, and there were multiple discussions about it. And I met the people who were doing it throughout the United States, and I got a lot of their feedback. And the feedback was so positive. You know, if they're doing it, it's easy to perform in the office. It's not painful. It's easily repeatable. And people were reporting, at least anecdotally, all across the country in multiple different locations improvements in their sexual inventory score. So what I'm getting at here is that I don't promise any magical results. I'm trying to give people very realistic expectations. So a man, like for example, Oris, a man that is on medication that isn't responding well to that medication might go through 6 one-week treatments, and after the 6 weeks and onwards out 3 months might start to notice that instead of not responding to those pills, now he responds to pills. Or a man that was responding to pills that didn't really like the medications suddenly doesn't need pills at all. So it's moving people up a class from severe to moderate, from moderate to mild, mild to none. You know, that's the realistic expectation that we're seeing with this kind of stuff. And we typically, as I mentioned, I alluded to the treatment protocol. We're doing 6 one-week treatments for the mild to moderates, and it's 10,000 shocks with a somewhat newer shockwave generator that generates a broader wavelength, so it's not as intense, so it's easier to easier to tolerate as opposed to the, let's say, older way of doing it, which is much more high intensity ultrasound. This is a little softer, easier to tolerate, and we give more shocks over a slightly longer period, getting the same energy into the tissue without causing skin breakdown and other issues. And so we do 6 one-week treatments, 10,000 shocks per session to 7 anatomical areas that correspond to normal erectile function. And I've got 2 men under treatment right now, and both of them are anecdotally improving in front of my eyes. They're saying it. They're straight shooter guys. One guy's like a New Yorker. He'd tell me straight out he's just said, "Awesome, Dr. Blick. I'm already 3 sessions in and I'm already seeing changes." So I think there's real science behind it. And I think we'll see more on it. I think we're going to start to see more clinical trials, more validation in the United States, more randomized controlled trials to really further elucidate. But like I said, it's been out for well over 15 years internationally, multiple studies, both here and in the United States, that really show a preponderance of evidence that this is working.
Okay. All right. You said 6 1 week. How many times each week? Is it once or is it?
So I'm doing one time a week for once a week for 6 weeks. If you have more severe ED, we do it for 12 sessions, and we double them up for the first 6 weeks. I have nobody in my practice yet doing 12 yet, but we have. But if the protocol would be double them up in the first 6 and make that happen in 3 weeks, and then do the others weekly thereafter.
Okay. All right. So now, how does a man or a couple, if they decide to do this as a couple, how do they find a good urologist?
It's a good question. I think today most people are finding people on social media more than ever, right? People are surfing the web, and they're using health grades, and they're using Yelp, and they're using, they're just going into Google and saying, I want to find someone who does erectile dysfunction, and they see who comes up. And many of us who are active in this field take a strong attention to our website presence, to our social media presence, and we're raising awareness out there, trying to get a message out. And you hope that through good social, good online research, that you can see what people are saying about you, what kind of feedback they're giving. And I think you can get a good characterization of a doctor these days just by online research.
Okay. All right. And if they wanted to see you, I think we've got posted in the notes section your address and your phone number and a link to your website, so they can find you and you have multiple offices in Phoenix. I
do, but I only practice at the one you've listed.
Okay.
You can also contact me or get more information through drblick.com. If you spell it out, drblick.com is one place to go. And I can get, people can, ask questions and sometimes contact me that way through email. I also have another website called ED Specialist. Actually, spell the doctor out.
Oh, you do? Okay. Sorry about that.
DOCTOR, drblick.com.
And I'm glad you spelled that out because I'm a dyslexic. And
that's all right.
Spelling is not.
You did it right. You just abbreviated it.
Okay, there we go. All right.
And I have one more site that you could check, that people could check, that is called ed-specialists.com. It's a little hard to say. So ed with a dash specialists, plural.com. That's another website that people could engage, get more information, read about. Yeah, that's right. You got it right.
Oh man.
ed-specialist.com. Awesome.
Okay. Thanks for spelling that out for me. Yeah.
Yeah, that's another site that both of my sites have good blog. They have good up-to-date information. They're links to other sites that provide further information. There's a portal for interacting with me and, asking me to respond for more information. So I think they've been very useful tools for me to interact with the community.
Okay. All right.
Yeah.
And just briefly, because we did not really have, we're going to talk about this, but there's another thing that you do called the UroLift. What's all that about?
UroLift is a minimally invasive treatment for BPH. Obviously, if someone has an enlarged, BPH stands for benign prostatic hyperplasia, but it's also just a lot of big words for large prostate. And if a man has a large prostate and they have significant symptoms that bother them in their life, they can try medications. However, just like in erectile dysfunction, many of them have side effects and they have ongoing costs, and patients don't tolerate well. And a lot of men would prefer to be off those medications just because they're not as desirable. So UroLift is this sort of minimally invasive, non-surgical approach to curing the problem of enlarged prostate. It basically puts these clips into the prostate to retract it, to make it wider open, to essentially pull the curtains open and make a wider opening in the prostate to facilitate better flow. So we're opening the prostate for better flow. And what it takes us 5 to 10 minutes. It could be done in the office if patients would like it, although I actually prefer to do it in the operating room under sedation. And it takes me 5 minutes to do. There's no cutting, there's no catheters, there's no hospitalizations. It's minimally invasive. And the post-op recovery is modest. There's just some transient symptoms like a little frequency and urgency, a slight discomfort when you pee, a little pressure down below, possibly a little blood in the urine. Most of it's over by the end of a week. And by the end of usually 4 weeks, most of the improvement is in place. And by the end of 3 months, you're completely improved in terms of what we're accomplishing. And I can tell you that probably about 80 to 85% of the men I do say thank you. And of those men that say thank you, about 90% of them are saying thank you out 5 years. So it's a very durable thing to do. It's minimally invasive, non-surgical option to treat BPH. Very popular now, very popular.
All right. Okay. Well, we've gotten through the informational, or as I refer to as the virtue part of my interview. But the old guy is not just about virtues. We're about vices. Okay. So the old guy's got a few questions to ask Dr. Blick here. And
shoot, man, shoot.
Okay. All right. And well, if you were to compete in an Olympic event, summer or winter, what would it be?
Winter.
Winter. What would the sport be?
Ski. I'd be a skier. Yep, I'm a skier. Yeah.
Oh, you're a big skier. Okay. All right. Yeah. Okay. What kind of music do you listen to?
Wow, I'm a classic rock fiend, but
okay.
I also love jazz fusion. So I love to. I grew up listening to Spyro Gyra, Chick Corea, Return to Forever, some of these classic fusion bands. But I'm also a classic rocker by trade. So I love to listen to people like Van Halen or Yes or Rush or Kansas, Boston, things like that. So classic rock, but my other side is the jazz fusion side. Love it.
All right. If you are eating something in the closet that you don't want people to see, that's bad for you, what would it be?
A cookie.
Any particular kind of cookie?
Chocolate chip cookie.
Chocolate chip cookie.
Yeah. I'm a sweet tooth, so if I can sneak a little chocolate chip here and there, I'm going to get me some.
All right. Does the good doctor smoke a cigar every once in a while?
Never smoked a cigarette in my life.
Not a cigarette, cigar.
Or cigar. Sorry, not even that. Sorry, I'm letting you down, but I don't.
It's a whole. Oh, we have to. I've introduced many of a person to this vice.
All right. I'm willing to experiment. I'm not opposed to it, but my mom was a heavy smoker, and I was animally opposed to the smoking thing. When I was as early as 6 years old, I was an activist against smoking. So it was very hard for me to adopt ever smoking a single cigarette in my life, or anything in that matter in my life.
Yeah, I interviewed a world famous humidor maker, and he described smoking a cigar as sitting around a campfire. So, which it is a lot. You can solve a lot of the world's problems. Alcohol.
My favorite alcohol. I guess I enjoy. Believe it or not, my wife and I enjoy Stoli Cosmopolitans. So,
yeah.
or a chocolate. One of my favorite drinks is a chocolate martini.
There we go. There we go. Yeah. Well, I like scotch, and I also do in the summer. I like to drink vodka, but
Yeah, I do like vodka drinks.
okay.
Solely vodka.
What would someone be surprised to know that you do? What deep dark secret do you have?
Dark secret, dude, that I do. Well, I guess growing up, I did my fair share of smoking marijuana.
Okay. Yeah.
So I'm a non-smoker for cigarettes and cigars, but I did smoke when I was going through college, and but these days it's not much part of my life. But
Yeah.
what else would you say? So people would be surprised. I'm an avid cyclist. I do a lot of road biking,
Okay.
so I exercise quite a bit.
Oh yeah. Well, that's I mean, when you sent me your picture, it was obvious that either genetically or you do something to stay so slim because you are obviously in very very good shape. So well, you know what? This interview went places I was not expecting it to go, and that's
That's what the fun of it, right?
that is the fun of it. That is where the gift is. That is where the life-changing information actually is. And so I appreciate you coming on this program and agreed to be interviewed. And you know, we'll have to pick another topic sometime in the future and talk about that.
I
So
love it. I
so
love it.
this is Oris, the old guy from www.oldguytalks.com. If you have not already opted in, why are you waiting? When you do so, you're going to get my 3 ways of how to get laid more frequently without begging. That's right. Without begging, you don't have to turn in your man card. Remember, it's all about creating a kick-ass life for yourself and those that you love.
Thank you.